Hey you guys, welcome to my channel. I'm Pharmacy Tech Love. This is where you're learning everything that you need to know about how to be a pharmacy technician. Hey, my future pharmacy technicians, what's going on? I'm sorry I shouldn't have left you without a dope video to watch too. You hear me? Okay, look, I'm gonna start asking you guys a question, okay? At the beginning of my video. Oh, but first, make sure you like, comment, subscribe, and share, please. These videos are for everyone, okay? It could be for your 17-year-old sister that's about to graduate high school, because now these kids are graduating high school early. It could be for your mom who's wanting a side hustle. It could be for your dad who's just wanting a second job. It could be for your brother who's needing a job. These videos are for everyone, okay? So make sure you share it to your sister, your cousin, whoever you feel like, hey, if they're undecided on exactly what they want to do with their lives, or just don't know where to begin, share this to them and let them decide on if pharmacy technician is a starting point for them, because this actually opens up the door to go into any medical field. I have a friend, he's a pharmacy technician right now, and he's actually working and he's going to school to be a doctor. Open the door for opportunity for yourself, and comment. You guys are wonderful about commenting in my videos. I must say that y'all ask me y'all ask me everything, and I try to answer every single comment. And if I don't answer every comment, I'll try to go back, a couple of days and go down a little bit further just to see who asked the question. But I am going to go into more detail on a lot of questions that you've asked, but there's a lot, and I don't mind at all. So make sure you like the video, make sure you comment, and make sure you subscribe. Hit that little bell, and then hit that little, I think it's a little notification bell, and it'll show like these little asterisks. Okay, so anyway, I want to ask you a question. What is your idea of perfect happiness? And I want you to think about that. Just really think about that. What is your idea of perfect happiness? And I want you to answer that in your free time for me. I would say my idea of perfect happiness is just to have a big family. Maybe one day have a big family. Right now I am 41. So I may have another child. I just have one right now. I may have another kid if I get married. So who knows? I like family, and I'm glad my sister has 4 kids and my brother has 3 now. Okay, first things first, I have a list right here in front of me of 10 things, all right? 10 things that you do not need to do as a pharmacy technician. Let's talk about number 1. Number 1 says, do not show up to work late consecutively. That is not a good look. It's exceptionally not a good look if you are just starting the job, okay? You do not want to show up, even if you've been there for years and years. That is not something that you need to do, is to show up to work late, because it's letting your boss know that you really just don't want to be there, okay? So that's number 1. What I have down for number 2, do not view yourself above or below your teammates or your coworkers, okay? You may know quite a bit about your job, but that does not give you the right to put yourself above them, because in all honesty, we are all pharmacy technicians. Unless you are a lead technician, but if you are the lead technician, then you need to show leadership, okay? You don't just need to be directing, you do this, you do this, you do this. Lead your team if you're in that position. If not, and you are just a pharmacy technician, we should all be on the same level, okay? All right, let's move on to number 3. Do not be rude to customers nor your coworkers. If you're going to be rude to the customers, you more than likely are going to lose your job eventually, because we have to give great customer service. If anything, we have to. Whenever they come into your pharmacy, you're asking for their information. They're pretty much there. The customers are actually giving you a job, okay? So I feel like you should be very appreciative of that. And I've also already talked on the point of not being rude to your coworkers. You are around your coworkers 40 hours a week. That's 160 hours per month. You're practically around them more than you are around your family. So why not get along? You know, I don't understand that. I have a friend. She is a nurse. She's a nurse and she works at a prison. And she just talks about how they just kind of bicker and argue and fight. And it's more just women. For some reason, it's always like that. Whenever there's a group of women, there's always a lot of bickering and fighting. And there does not have to be. You don't have to really be that way. It's called being an adult, okay? It's called being an adult. So make sure you treat your coworkers and especially definitely treat the customers with respect, okay? Because like I said once before, you will have customers that will come in with illnesses. It could be cancer, it could be heart attack, stroke, whatever it is, no matter what it is, you treat them with respect, and prayingly, they will treat you with respect, okay? All right, let's talk about number 4. All right, it says, do not come to work, do not come to work, pretty much grooming yourself, eating, and socializing, okay? That's not why we come to work. Whenever I clock in, I'm not going to the bathroom to put on makeup. Whenever I clock in, I'm not going straight into the break room and having breakfast. No. That's for later. That's for later. I don't clock in and try to do as much socializing as I can. You know, if I am going to socialize, I'm actually going to be working and socializing, trying to do 2 things at once. You know, just to, and we need to catch up from the previous night or the previous day if you don't work in a 24-hour store. But that's not why I come to work. I come to work to actually work, because I know it will fill up my 8 hours a day, and you have to be productive. Your boss will take that into account if you're not a productive person. So please don't clock in and go straight to the bathroom and be like, oh, I got to do my makeup, my hair, sweetheart, you got to do that at home. You have to do that at home before you come to work, okay? Don't clock in and go straight to the break room and start fixing your entire breakfast and sit there for 20 minutes after you've clocked in. No, that's not a professional way of doing things, okay? And we are trying to exude professionalism since we have chosen to be healthcare professionals, okay? All right, number 5. Number 5 says, do not have a bad attitude in the workplace and do not place personal problems on coworkers, okay? Definitely don't have a bad attitude, all right? Because it just, you know, I think the expression is one bad apple can ruin the entire bunch. And I've seen that happen before. I've seen it happen before, okay? So don't be that bad apple that's ruining the entire batch of apples, okay? Because you don't want to be that person that's angry and mean and mad all the time, because that spills over into the workplace. And you don't want that to happen, because then it'll almost be like a domino effect. Everyone will start being the same way. So how about you be positive? Whenever you ask your coworkers to do something, say thank you. You know, I appreciate you doing that. If they do something that you didn't ask them to do, say, hey, I really appreciate you doing that. Thank you so much. That goes a long, long way. So be respectful, be mindful, and have a positive attitude whenever you go to work. Just try, even if you're having a bad day, just take a minute, take 5 minutes to yourself inside of your mental, and just tell yourself, okay, this day is going to start out great. I'm going to think positive. I'm going to be positive. I'm going to act in a positive way. Okay. Sometimes we have to be our own coach. I have done that several times. Be your own coach. As they say, be your own cheerleader. Why not? Okay. Let's continue on. Number 6 says, do not share patients' information. Okay. You cannot do that. You are breaking HIPAA laws, the Health Insurance Portability and Accountability Law, Act. And that's what HIPAA stands for. It's HIPAA, Health Insurance Portability and Accountability Act. You can be fined. if you share patients' information, and you possibly can do some jail time, okay? So that's not something that you want to do. Listen, the way that you talk about a patient's information is basically you don't add names, birthdays, phone numbers, just anything that's going to come back to that patient, account numbers, social security numbers. You don't talk about any of that. Now, you may say, I had a patient who had a stroke. Okay, all right. Okay, well, that's not breaking HIPAA laws. Or you may say, I had a patient who had a runny nose. That's not breaking HIPAA laws. When you start naming names and room numbers and bed numbers and account numbers, you are going to get yourself in a world of trouble. So do not break HIPAA laws, okay? I cannot stress that enough. There are going to be times when you may know someone. You may know this particular person, or you may know someone that knows someone, or that knows that particular person. That is not your place to discuss anyone's personal business, okay? And as I said, if you do have to discuss it, or you do want to talk about it, which your pharmacist will discuss certain things about patients, but they know to not say a patient's name. You just cannot do it, okay? That is the law, okay? All right, we are at number 7. Number 7 says, do not accept new medication orders. That is the responsibility of the pharmacist. Whenever a nurse or doctor calls, we'll just say that this is retail that I'm discussing. Whenever a nurse or doctor calls your pharmacy and they say, I need to, now they don't know anything about new prescriptions and refills, because it's not for them to know. It's for you and the pharmacist to know these rules, okay? So we'll say a nurse calls and says, I need to call in a prescription for, I always like to use the name Victoria's Secret because I just love Victoria's Secret. Okay, so we're just gonna say the nurse or the doctor calls in and says, I need to no, I'm not even gonna use the word refill. I need to call in a prescription for Victoria's Secret. And you say, okay, well, what's the patient's date of birth? And they tell you 1900, we'll just say 1900. And you pull the patient up by the birthday, they give you the last name, and we'll say that the medication says take 1 tablet, we'll say lorazepam. The medication says take 1 tablet by mouth twice a day. You got it? Take 1 tablet by mouth twice a day. Okay, so this time she says, well, instead of twice a day, I need the patient to take it 3 times a day. That's when it turns into a new prescription. That is not a refill. A refill means that nothing is changing about the prescription except for we need a refill. We're adding a refill onto the medication, onto the refill list. Now, when they change something, okay, it doesn't matter if it was take 1 tablet, now it's changed to take 2 tablets. It doesn't matter if it used to be BID twice a day and now it's TID 3 times a day. If that changes, that is now a new refill, and you have to give the phone to the pharmacist, okay? Just want to make sure everyone understands that, okay? So if it's ever a new prescription, and sometimes you just ask. If you don't know, say, hey, is this a new order? Is this a refill? And sometimes they may say, well, this is a refill, but I need you to look at those directions and see if they are exactly the same. If they are not, just place them on hold. Hey, let me put you on hold real quick and let me let you speak with the pharmacist. And you pass that call to the pharmacist, okay? All right, moving right along. Number 8, I believe we're on number 8. Number 8 says, do not give out the wrong medication. We definitely don't want to give out the wrong medication. Sometimes it will happen, but in order to eliminate it from happening, of course you have your pharmacist that's going to double check your work, but also now I'm discussing retail, not the hospital setting, because a patient is not going to walk up to you in the hospital setting. That's not how that works. But in retail, these are actual customers that are coming into the pharmacy that is giving you their information and asking to pick up their medication. Oh, excuse me. As discussed in a previous video, you need to ask for the patient's address, phone number, and date of birth. Now, if it is a controlled narcotic, please ask for their identification, okay? I need you to do that, all right? So we'll make sure that we're giving out the right medication to the right patient at the right time and at the right dose, okay? So we need to make sure that we are doing that. So try to avoid those errors. I mean, you may have, like I've discussed in my I got fired video. You may have 3 patients with the same name, but you can rest assured all those people are not living at the same address. All of them do not have the same phone number, so verify those vital pieces of information, okay? All right, let's discuss number 9. Do not steal. Why would you? Your mother, your father, someone taught you right from wrong, okay? All right, and free will, that should let you know, hey, and something inside of you is going to tell you this is not the right thing to do, okay? So do not steal. If the FDA shows up and you know that you've been stealing, I don't know what to tell you to do, because I've never been in that situation and I don't plan on it. So don't risk your certification that you've worked hard for. Don't risk your freedom trying to steal, okay? When you become certified and your family starts to know, and your friends begin to know that you're certified, they will look at you in a totally different light. They will sometimes look at you as the drug person. No, don't allow that. Don't allow that at all. Just shut them down immediately, okay? That's what I need you to do. Shut them down. All right, number 10, stay in your scope of practice. You are not to counsel patients, and you are not to do the final check, okay? When I say stay in your scope of practice, what I mean by that is do not act as the pharmacist. That's what I mean when I say, it's almost like saying stay in your lane, okay? It's almost like saying that. So stay in your scope of practice and do not act as the pharmacist, okay? Because we don't need them to act as the pharmacy technician. We need them to double check our medications, and we need them to be able to counsel patients. Like I tell my students, if, say for instance, a mother comes into the pharmacist, into the pharmacy, okay? Say for instance, a mother comes into the pharmacy with her child. We'll say the baby's 5. Okay, so the 5-year-old it has a fever, okay? Has a fever. And you know that taking this child a cool bath or giving this child popsicles, we'll say that you're a mother or a father yourself. So you know to take this child a cool bath or give this child ibuprofen or a popsicle, something simple as that, okay? You know that because you've been a parent before, okay? All right, so even though you know that, you do not have the right to counsel that patient. Whenever that patient comes in and says, hey, my child is having a fever, what can I do? Oh, okay, ma'am, let me bring you right down here to the consultation window and let you speak with the pharmacist. That is exactly what you're supposed to do, okay? All right, these are my 10 don'ts, okay, as to being a pharmacy technician. So please follow these, and I will see you guys next time. Bye. Hey, if you made it this far in the video, make sure you like, comment, share, and subscribe my videos. But I have 2 more don'ts as far as being a pharmacy technician. I text 2 of my good friends that are pharmacy technicians, so I'm going to read both of those off to you, okay? One is to do not judge. We shouldn't judge or assume that a person is taking a medication for what we think is wrong with them. And that is absolutely correct. A lot of medications are used for several different things. So don't assume that you know and start placing judgment on that person just because of that particular medication that they're taking. And we're not supposed to judge anyone anyway. You may hear my dog. Okay, moving on to the second one. Never leave pills out on the counting tray unattended, especially controlled narcotics. And I guess here's a third one. Here's a third one because she gave me 2. She said, don't mislead the customers about wait times on their prescriptions, on when it will be ready. Don't say, okay, we'll have your prescription ready in 10 minutes, unless you know for a fact that you are going to have it ready in 10 minutes. Normally, the wait time is at least an hour, depending on how busy you are, okay? So please don't mislead your customers. That's actually all I have for you. Thank you for watching my video, and I will see you in the next one. Bye.